So we're really excited, though, to close out our session here today with a conversation with Lauren LeGate, who is the Deputy Commissioner of the newly created Department of Disability and Aging. Throughout the day, we've talked about what the states can do with market leaders, with advocacy groups, et cetera. And so we're really excited to be able to do this. We also started the conversation today talking about things like loneliness and other issues that I'm sure will come up as we talk about the new department. So with that, I'm going to welcome Lauren LeGate up to the stage.
So Nashville traffic is really bad, so I'm not going to take that personal. Thank you guys for sticking around. I know you've had a long day with some great content, and I'm so thankful for that, just to be a part of the discussion. I think some of you maybe were on a panel with some of our members a little bit earlier today, so hopefully you may have learned something about the department. But I was just kind of asked to come up here and talk about where we've been, where we're going, how this all kind of came about in the state of Tennessee, and you know, it's just very important to us. I made a career change personally about 5 years ago, and I stepped away from what I was doing, what I'd spent my whole life doing. I was the breadwinner. I had 2 small kids, and I walked away and moved to this city with no job prospects. But I knew there was something more out there for me. I was supposed to be serving more. There was more of a mission that I had to do. So this is very passionate for me because I did land with the department. And I've held several roles with the department. And again, I just had that faith, and it came to this, and I'm just such a proud part of it. And I'm really glad to share with you all. We've got a lot of great people that work really hard to support people. So quickly, I'm going to go ahead and get to this next one. Here we go, who we are. We're the newest cabinet level state agency as of July 1st. We are replacing ourselves. We were also the newest level cabinet state agency prior to that. On July 1st, we did assume the aging population, the Tennessee Commission on Aging and Disability, now just known as the Aging Division within our department. We're responsible for services and supports for more than 1.5 million people with disabilities and older Tennesseans. More than 1,600 employees we have statewide in different offices serving different folks. Our mission at the department is to empower, support, and enhance the lives of people with disabilities and older Tennesseans by promoting independence, inclusion, and the pursuit of lifelong health. The vision we have is to create an environment where every Tennessean, regardless of your ability or your age, has the access to the resources, support, and opportunities needed to thrive and contribute to their communities. Prior to bringing on aging, we thought that people deserved the right to live their lives how they wanted to live, not where their parents told them to live or where their providers told them to work, what they wanted to do. And that's the same energy we're bringing to the aging population. Just because you're 70 doesn't mean you have to go live with your son. What do you want to do? And how can we make that happen? We do have quite a past, and that's why we always talk about it. We know what happens when you don't remember the past. You have an opportunity to repeat it, not something we're willing to do. In 1923, we had our first institution that was right down the street in Donaldson. Another institution in East Tennessee came about in 1960, and in 1968, an institution in West Tennessee. So several decades ago, if you had a child with a disability, you were told the best, most humane thing you could do for that child was to drop them off and never see them again. And you see these images on the screen, cribs made to be cages, children just looking out the window and people just being left to sit there. We've come a long way, and we're super proud of that. A little bit about the history. In 1995, developmental centers started to be the subject of investigations by the Department of Justice. In the early 2010s, residents started to move out of centers into community homes as a result of some of these federal lawsuits. And in 2017, not that long ago if you think about it, the last person was moved out of developmental centers statewide up in East Tennessee and Green Valley. We had at that time, I think the max throughout the years was maybe close to 2,000 in each center. We had about 100 people in each center at that time, and we built community houses, and we started to transition people into those smaller group homes so they could be out of institutions and into their communities. We saw some incredible growth. While all these lawsuits were going on and we were closing facilities, we had we still had one foot in that past, but we were going full throttle for the future. We became the Department of Intellectual and Developmental Disabilities, changed from mental retardation services. Our advocacy services unit was formed. We taught people how to advocate for themselves. We held statewide family training sessions across the state, because these were the same families that we also told, drop your kids off at the institution. That's the best you can do for them. That's the life they're going to live. We created our person-centered practices. Person-centered practice, I know it's a term we all hear. It was very new back then, and it's still really at the heart of what we do today. You decide what you want to do and how you want to live and what that looks like. Employment First initiative began, the HCBS settings rule. We are network accreditation. We were really proud of that. That happened, we were still dealing with institutions, and it meant a lot to us to know that we were making some progress. Employment Community First Choices begins, and our focus on enabling technology started. Enabling technology is one of the areas in aging we really think will transfer well, and we're really proud of the work we do in that area. This is our commissioner, Commissioner Brad Turner. He was appointed back in 2019 by Governor Lee. Under his leadership, it's ushered in just an extraordinary time of growth for the department. We added TEIS, which is Early Intervention Services. It was previously with the Department of Education. We also brought on Katie Beckett. I'll talk more about that in a second. And then, of course, aging on July 1st. We brought over those services. So we are one of the largest state departments now, a pretty large shift in the last 5 years. The most important thing about Commissioner Turner, though, is that he is a dad. He has one daughter that has intellectual and developmental disabilities. She's in a wheelchair. She can only say a couple of words, and that is his life. He's got a bad back because he carries her up and down the stairs. He lives that every day of his life when he leaves the office. And he would not want me to say this, and he would call me a brown noser if he were here, but leadership matters. This is no coincidence that we've had this tremendous amount of growth and that thousands more of Tennesseans are getting great supports and services, and that our reach has grown. His leadership is phenomenal. And it matters who we have in our companies and our state departments, inspiring people and encouraging people. We've got a couple of our employees here in the room today, and I could probably tell you most of us would run through a brick wall for Commissioner Turner. He'd do that for us, and most importantly, he'd do that for the people that we support. So who we are now, this is the important part. We're one of 14 states with no institutions, so 14. That means a lot of states still have them, but we're getting there. We are getting there. We're the leading state in utilizing technology for independence, support, and skill development. Humble brag in the next bullet point. In 2022, 17 states asked for support in system transformation related to community services. Fancy way of saying they called us and said, how are you doing it? How did you get people on board? How are you prioritizing technology and employment? And since 2019, thanks to the generosity of Governor Lee and the legislature for seeing our vision, they've invested $500 million in disability services through DIDD and now DDA. That was something that just was not happening years ago. And we have made the fiscal argument that you invest now in home and community services, you do save that on the back end. You know, it's a smart money move, but ultimately it's the right thing to do. A little bit more about who we are now. Again, our enabling technology program, one of the best in the nation. We have a program called MAPS, Medicaid Alternative Pathways to Independence. That launched in 2022, several hundred young adults, and I actually think a couple older adults are enrolled in that program. It just helps fill that gap of, I don't need to go and live in an institution or an assisted living facility. I just need a little help. And that's what MAPS does. Our Tennessee Early Intervention Program, the child count there has increased rapidly. We're also now the only state to offer services up until the child goes to kindergarten, which is a pretty big deal because that means they're going to have seamless supports and services. And again, just another plug, when you get to them early, that means you can get them up to reading level and get them up to peer level a whole lot quicker when you make sure they have continued services. And you'll see that growth throughout their adulthood. Our Katie Beckett program, it helps families with children with medical or complex needs. If they can't get Medicaid, but you know what, it still takes a lot of money to give a child with disabilities all the supports and services. This is just a little cushion. And these are working families that just need some support. This one has been just hugely impactful. And then our START program. Not a lot of people hear about this one, but it's really important. It offers assessment, stabilization, and crisis response for folks with IDD and mental health needs. It seems post-COVID, mental health is a concern for every one of our demographics. Our IDD population and our aging population are no different. But what this does, if you have a co-occurring diagnosis of IDD and mental health, you have someone that if you're having an episode, if there's something happening, we step in, you call us, and we try our best. And we had an upper 80s rate of success of keeping you out of the hospital or out of a jail cell, because we know how to get in and to triage these situations. Again, it kind of operates in the shadows, but it's so important for what we do. So aging services, I've been working in the transition space since about January. Again, it became official on July 1st, but we are now the state unit on aging, so we're responsible for distributing all of the money, the millions of dollars that is given to us through the Older Americans Act. We work with 9 area agencies on aging and disability. They are across the state, and they provide those services. So we provide fiscal oversight and other sorts of supports and services for that. Some programs, information and assistance, our Ombudsman program, which is an advocate program for those in assisted living facilities, a family caregiver, nutrition services. Nutrition is our biggest service. It's a meal, but what we say in our office and statewide is it is so much more than a meal. It's someone laying eyes on that person, making sure they look okay, make sure they're getting around okay. Could be the only person they see that day, could be the only person they see that week. It's a really important program. Disease prevention and health, and also our state health insurance assistance program, which is now open enrollment. We offer benefits counseling for folks who may need it. Some state-funded programs we have, public guardianship options, our respite pilot program, and our senior center grants. So where are we going? We've got a lot of work to do. But we're really proud of what we've done, and we're really just anxious to get started. We're going to improve supports for those affected by memory-related illnesses. Memory-related illnesses are reaching the levels I always compare to autism. Everyone knows someone with autism or a family member dealing with someone with autism. It's the same thing with Alzheimer's and other dementia-related illnesses. Not only do those folks need help, but those caregivers need help, those families who are working all day and going home to assist a loved one with a memory-related illness. So moving in the right direction in that space. Also utilizing our state partners to support older Tennesseans in the areas like home modifications, elder abuse, caregiving, and again, nutrition. But caregiving is one of the areas where it does cross over into aging and disability. Caregivers need our help. At some level, whether it's through businesses and corporations doing what they can do for their employees, whether it's through respite, just something, honestly, what you can't do is just see people. I see what you're doing. I see you're struggling. I see the weight that it is to care for your mother in your home. So we're looking at it all. Sometimes recognizing folks takes a little less money, so we'll probably get to that one first. Strengthen our partnership with DCS. This is one of the areas we can't talk a whole lot about just because of the nature of foster children, but we do care for foster children with intellectual and developmental disabilities. We see those as our kids, and it's our responsibility to step in and help, and we're looking to do more in that space. Increase respite opportunities, again, across all the populations we serve. Commissioner Turner is a great example. Prior to the Katie Beckett program, I don't think he'd gone anywhere in years and years, because he just didn't have that support structure to care for his daughter, and people deserve a break. We all know that. And then developing solutions for large-scale concerns, things like housing and transportation. The average Tennessean deals with that, so definitely our populations that are dealing with disabilities or aging concerns. Those things aren't getting better over time. You know, we came out of post-COVID and we kind of waited for a bounce back. I think we're at the point now where the bounce back has happened and we kind of just got to start to see, okay, where can we step in and support? And those are big things to take on. I know the housing issue we've been working on already for about 18 months. I think we're getting somewhere, but again, it's large scale. And I promise I keep it quick. I just wanted, again, to kind of wrap up with the mission and the vision. The key words to us: empowering people, independence, inclusion, lifelong health. Those are the things we think about every day in our office. Just everybody deserves it, not just you and me, because we have able bodies and able minds. That's what everybody deserves. And we just hope to work with our outside partners, our inside partners at the state to just move the needle. We know it's slow, especially in the aging population. You all probably know the figures on older Tennesseans and older Americans and how large that population is going to grow in the next 10 years. It's time now to start having those discussions so we're ready and we're prepared. And thank you guys, especially for sticking around. I hope traffic's not too bad for you. We're very active on social media. I'm super biased, but I do think we have the best communications team in the state. If you have any questions or are curious about any of our programs, we have videos, we have reels, we have all the things. I'd love if you would go give us a follow. So yeah, thank you. I know we have a few minutes for questions. I did try to get through that quickly. I can't really see anybody. But if you do have any questions, I'd love to try to answer them. Hi. Thank you.
With respect to being more inclusive of those folks who have disabilities, either mental or physical, in the workforce, and providing them extra support and services to enable them to re-enter the workforce or to stay in the workforce effectively. I'm just curious as to your perspective on how Tennessee is doing with that and how the nation is doing, and then related to that, what your thinking is about folks who are elderly but also still want to participate actively in the workforce beyond what would be traditionally regarded as being retirement age.
Those are great questions. First up, I think we're doing a great job. That doesn't mean that there is a ton of work left to do. You know, it's always going to be a capacity. It's always going to be a money issue. We are very big on engaging people outside of state government because we know we can't do it alone. We can't pay for everyone alone. When we had a budget hearing yesterday, and we had a very long list, but so did all the other 22 departments. I think we're doing good. We have an innovation team. We've invested in it, and we're always trying to do better. But until I don't think I'll ever be satisfied until I feel like every person has what they need. And really, with our older population, I mean, there are some simple things that people could have in their homes that could keep them in their homes. You know, and we're not taught, I mean, ring doorbells. You know, it was super snazzy 15 years ago, 12 years ago, and now everybody has one. But that could mean a lot, just little investments like that, iPads for interaction, iPads for medication reminders, things like that. What was your second question? I'm sorry. Yes. So, you know what? In state government, you hear the term silos, and it's just all because we're working so hard for what we do in our mission. But we do get that way, and I've actually got a call with someone from the Labor Department next week. That's one thing that I think that we don't like, that there's an assumption out there because I'm a certain age, I don't want to work, or that I can't contribute to society. Man, these people got us very far, and they need to be respected and valued for what they've done, how they've built their communities, and how they can still contribute to ours. And you know, contributions could look differently. And I think we just assume that people don't want to be involved, don't want to be engaged anymore. So yeah, there are some efforts. And I love that people now are thinking of that in other spaces besides ours, because we have had some discussions already. Senior centers for us are really exciting because on the IDD side, we don't have like a place where we can go where our folks are just there hanging out. We've got over 150 senior centers statewide, so things like employment opportunities, that's exactly where we're taking that. Enabling technology, that's who we're working with. Want to come learn how to do an iPad and maybe take one home to do X, Y, and Z? Well, you know, come to the senior center on Tuesday and we'll show you how. So those are great questions. Thank you.
Thank you. Congratulations on closing the last institution. Just a question about that. When many psychiatric institutions were closed, we find we now have a shortage of psychiatric hospital beds. How can we make sure that there still is no need for institutions? What is the difference with this population and what Tennessee has done?
Well, that's a great question. And, we did, at the time when this all happened, we were kind of combined. Now we have a mental health department that looks for those needs. But again, just like we have psychiatric concerns in able bodies, so do people with disabilities. Our Director of Clinical Services, Dr. Davis, that START team, that's who they help, people with those co-occurring diagnoses. But what we want to say is that we don't want to just assume and take you here because you have an IDD. We want to make sure that we're giving you all the supports and the services. There's been a long-standing battle of, well, they did that because they had a disability. No, maybe they did that because they had a mental health need, a mental health diagnosis that was either undiagnosed or, do you blame the disability or do you blame that? I think in this day and age, the mental health shortage is out there just because it's more prevalent now. We're talking about it more, which is a beautiful thing in the aging population as well. But could we be doing better in that area? Absolutely. But I do think when those institutions closed, it was more of, how did they show up to that institution? Were they performing? Were they interacting the same? Probably not. But that's definitely, we've got a whole unit on clinical services because that is something, unfortunately, that not everyone can operate in society. There are always different levels, and I definitely don't think we ever label, and everybody can go live in a community home in a neighborhood, but sometimes that's not an IDD. Sometimes that's more of to your point, a psychiatric concern. Okay. Hey.
Thank you. Hi, I have a question about, thinking in the future about the increasing aging population. What work or considerations has the agency given to those who do not have immediate family? Most of the in-home support services type things are for people that have family to provide, to fill in the gaps that aren't covered by those services. So I wanted to know what considerations have been given, and then also thinking about those who have the IDD designation as they get older and may not have children or family to care for them as well. What solutions are available?
Yeah, that's we're still in the information gathering stage. I'm about 6 months in, and that's something we've always heard. But we hear it more and more now. And they talk about, people, you grew up, you got married, you got a house around the corner from your mom and dad. They needed anything. It was, common knowledge that when they got older, they'd move in with you. Then, society kind of changed and people got jobs and they climbed the ladder and they moved away. And people don't have that support. And it is very much on the forefront of a lot of people's minds. And I do think those are probably the people that we deal with the most. Are people that just don't have anything. It's a gap. What's also really hard is we've got a workforce shortage that unfortunately has, again, post-COVID, not bounced back. We are where we are now, and we have to get creative. We do want to start supporting family caregivers as much as we can, but to your point, not everyone has one. I do think a lot of our efforts are into just trying to invigorate that workforce. We hear a lot about the younger generation. This next generation coming up is the one you can really appeal to as far as service and empathy. So they've started high school programs, not having to go the college route, just getting right into direct care. But I think a lot of efforts into that. And again, you hate that it's a large problem, but because of that, there are so many people that are trying to work on it. Just in state government, I can think of 5 departments where that's a huge issue, and we're all trying to figure it out. Thank you. These were great questions. Thank you all so much. Glad y'all had a good day.